For the majority of this class, we've been focusing on patient-provider communication about either ourselves or our loved ones, like our children or our elders. From the foods we eat to the medicines we take, we are constantly making health decisions for ourselves. But what about strangers? What health communication influences the health decisions that we make for them, especially when at our own expense? Fortunately, I had just the person to ask about this. Meet my mom. In addition to donating over 5 gallons of blood in her lifetime, on February 6th, 2014, she donated bone marrow.
I was very excited when I got the call to donate because I thought I had the opportunity to potentially save the life of someone who needed it. In my particular case, they asked for bone marrow. Of course, under anesthesia, they flip you onto your stomach and they draw bone marrow from the back side on each side.
The service my mom donated through is called Be the Match, operated by the National Marrow Donor Program, and is a nonprofit organization that has facilitated more than 111,000 bone marrow and blood stem cell transplants, has more than 400 centers worldwide, and has more than 1,650 research publications through the Center for International Blood and Marrow Transplant Program. Donating bone marrow means donating healthy, blood-forming stem cells to a cancer or blood disease patient, where the cells are put into the patient's bloodstream and begin to grow and create new, healthy blood cells. Stem cells can be collected from bone marrow, like my mom's case, from peripheral blood, or from an umbilical cord after a baby's birth.
They don't tell you who you're donating to. They did tell you the basics, like that I know that it was a young child overseas in Europe that actually my bone marrow went to.
If donors don't ever meet their recipient, why do they donate? Let's explore a few reasons. First, altruism. New Jersey City University notes that altruism can provide a sense of direction and bring a purpose to life, and that seeing the power we have to touch lives can make us feel less alone in the universe and give us meaning. By donating stem cells, we not only have the power to touch lives, but to save them. Donating reaffirms to the patient that there are multiple partners in their health journey, not just them and their doctor, but an anonymous donor is also supporting them. Second, cost.
It's a potential to save someone's life, and it doesn't cost you, the individual, anything.
Donating to Be the Match is cost-free for the donor, paid for either by the recipient's insurance or Be the Match. Be the Match also covers travel and lodging costs for donors and one companion if necessary. Third, the procedure. Be the Match has coordinators that inform donors about the donation procedure, the possibility of side effects, and how long it will take them to return to their normal routine, adopting a biopsychosocial model of communication. Be the Match prioritizes their transplant education and advocacy, with their donor coordinators and web pages full of the most up-to-date information about donating and debunking donation myths. Be the Match knows that donor empowerment is important not only in recruiting donors, but receiving donations from matches.
After I donated the bone marrow, they said the process itself will feel like you maybe slipped on ice and just be sore. And all you would need is aspirin or Tylenol. And that actually was true. There really wasn't any side effects, repair. I think I donated on a Thursday or a Friday, and I was back to work on Monday. No side effects, no problems, no issues.
The Health Resources and Services Administration of the United States notes that approximately 18,000 people per year are diagnosed with life-threatening illnesses that could be treated or cured with a bone marrow stem cell transplant. Be the Match reports that only 30% of patients are able to find matches within their family, meaning that 70% of patients rely on unrelated donors. About 80% of white patients find a match through Be the Match, but for patients of minority and mixed races, the likelihood of finding a match is dramatically lower. Be the Match says that to increase the chances of patients finding a match, more donors need to join the registry. Joining is as simple as filling out a survey and completing a cheek swab. Be the Match will do the rest. Effective health communication tactics hardly vary, whether for our own health decisions or those that impact a stranger's health. Empowerment directly leads to more informed health decisions. Be the Match understands the mental, emotional, economic, and biological impacts of donating and is available to answer all of their donors' questions. Making health decisions for a stranger, when donating blood or bone marrow, means the donor selflessly considers another's health before their own. And I couldn't be prouder of my mom for doing it.